What's up everyone, it's Dr. Pete. I want to talk to you about what chiropractic is capable of. 99% of chiropractors, if you go in their offices, 99% of the people in there are there for neck and back pain. So what does that tell you? What you must think it's capable of, because that's who's coming in your office. Now there's a few chiropractors who might help the sinuses or whatever, but you know what? Or headaches or whatever it might be, but most of those chiropractors going beyond neck and back pain are doing it with things that are not chiropractic. By the way, chiropractic is the Greek word for done by hand. So when I say not chiropractic, you're like, oh yeah, I'm a chiropractor, but I learned a little acupuncture, or I give some vitamins or herbs or whatever, which is fine, but it's not chiropractic. So what about doing stuff with just true chiropractic that goes way beyond neck and back pain? So for example, let's talk a little bit about the history of chiropractic. So as you know, you're a chiropractor, so you know, 1895, D.D. Palmer creates chiropractic. For the first couple years, he didn't want to teach anyone, but a few things happened, he decided to teach people. So in about 1897, he opens a school. Now this is the way his school worked. He didn't have a lot of books on anatomy, physiology, neurology. He would stand up and he'd have a group of people around him. Some of them were medical doctors, some were osteopaths, some were very uneducated people. And he would talk about what he called the big idea. The big idea was about what he called racking bones back into place, not some specific adjustment that they talk about now. It's specific in its own way, but he called it racking bones back into place. And creating the proper tone in the nerves. So the nerve with a proper tone can flow to the organ, tissue, cell, so it could function properly. But the main thing he talked about was the big idea and about innate. You know what innate is, you're chiropractors. The big idea is the main thing. And here's the thing, when he would teach these people, could be a week, 2 weeks, 3 weeks, few months, when someone would stand up and say, I've got the big idea, he'd say, come here. And he'd give them their graduation papers then and there and send them out to help people heal. Nowadays, what's chiropractic school? 4 years of college, 4 years of chiropractic school. After 8 years, and then you take all these extra classes or whatever technique you're checking out, then you go out and you try to help people. But these chiropractors with D.D. Palmer, and by the way, D.D. Palmer got better results than almost anyone who ever practiced. If you want to learn how when someone comes in your office with a thyroid situation, an autoimmune situation, a circulatory situation, digestive situation, whatever it might be, and they tell you they've been to 2 MDs, 2 chiropractors, 2 acupuncturists, 2 homeopaths, and again, are you saying, hey, Dr. Pete, are you revolutionizing chiropractic? Are you changing chiropractic? No, I'm not changing anything. This is chiropractic. And who knows more about chiropractic than the founder? No one. He invented it. He created it. He defined it. So if the founder of chiropractic, again, check out his book, Chiropractor's Adjuster, 1910. If the founder of chiropractic is talking about, you know, all these things that go way beyond neck and back pain, well, I'm just carrying on that tradition. Now, it happens, we got 1895, D.D. Palmer. In 1910, after 15 years after he creates it, all these so-called chiropractors that maybe graduated other schools are practicing, and he wrote the Chiropractor's Adjuster, if you look in the book, not to teach them how to adjust. He wrote it to adjust their minds. He wrote it right in the book. He said, I'm adjusting your mind because you don't understand what chiropractic is anymore, and I'm going to adjust your mind and tell you. The more important part is understanding what heals, and if you understand what heals, you'll get amazing results. Now, I went to chiropractic school also. I remember the debates between the straights, the mixers, the hard adjusting, the soft adjusting, the upper cervical, the full spine. I remember hearing the Gonstead philosophy that was so different than the chiropractic biophysics philosophy. I remember the Gonstead people saying that leg checks were worthless, and the Thompson people doing everything based off leg checks. So I'm not interested in debating all this chiropractic philosophical stuff. I'm interested in showing you stuff that will let you get results that you never even thought you could get. With that said, I look forward to helping you. I will help you. Take the class. The results will speak for themselves. See you soon. I'm here with Laura assisting me. Thank you, Laura. I want to talk about the zone technique itself. So, you know, most chiropractic techniques, they're what I would call intersegmental bone moving techniques, where you're finding where the spine is not in place and putting it in place to take pressure off the nerve, which is great. And the zone technique addresses that too. But the zone technique does something really cool, which I don't know any other technique that does this. It makes sure that the brain is sending the proper signals out to the cells. Meaning, chiropractic in general makes the assumption, here's the brain, sending signals down the cord, and then those signals from the cord come out of the nerves and go to the different cells of the body. Well, the chiropractor will adjust the bones back into place to take pressure off the nerves, as you guys know, you're chiropractors, so the brain signal can come down from the cord, brain signal can come down from the brain, down the cord, out the nerves. What about if the brain's setting the wrong signal in the first place? So big deal, you opened up the nerve flow, into the organs, but what if the initial signal is wrong? So there's points in the back of the head. I'll teach you all this later. There's points in the back of the head, and when you feel them, the points in the back of the head are related to the different brain centers. So there's a part of the brain that controls all your glands, it's in your cerebellum. Part of your brain that controls all your eliminative organs, it's in your cerebrum. Part of your brain that controls your nerve system or your nervous system. Of course, the brain is part of the nervous system, part of the central nervous system, but there's a part of the brain that governs the whole nervous system in the cerebrum. There's a part of the brain that governs the digestive system, it's in the fourth ventricle of the brain. Part of the brain that governs the muscles of the body, that's in the cerebellum. And there's a part of the brain that governs the circulatory apparatus of the body, and that's in the caudate nuclei, both of them. So, points in the back of the head will tell me what's happening in the brain. If one or more of the brain centers is sending the wrong signals out to the body, then that part of the body is not going to function good. So when you know what's happening in the brain, there's certain points in the spinal cord that you can stimulate. You might say, oh, I'm already stimulating the cord. I don't think so, because you have to stimulate them in very exact spots. And when these very exact spots are stimulated, then you actually have energy sent up the cord to the brain so the brain can heal and then be able to govern the body properly. Now, two things happen when the brain is balanced. One, a balanced brain can monitor the parts of the body it controls. And two, is it can send the right signals to it. Let's take, for example, the digestive system. So there's a part of the brain in the fourth ventricle. If that part of the brain is not balanced, it is not monitoring the liver, for example, properly, because the liver is an organ in the digestive system. And because it's not monitoring it properly, it doesn't know what exact signals to send to it so it can be healthy and function right. And even if it was monitoring it properly, which it's not, but if it was, it can't send the right signals to it because it's not balanced. But a balanced brain center can monitor the system that it controls properly and send the proper signals to it to be healthy so it can function right. So, feel the back of the head, see what's happening in the brain. The body's like an electrical machine. The brain is the positive pole. The spinal cord is the negative pole. There's certain points in the negative pole that I will stimulate that relate to the different points in the positive pole. So if Laura can lay down, let's give a little demonstration. So I'm going to feel the back of Laura's head. Now, everyone's head is hard, of course, but if you know where to feel on the superior nuchal line, which I'll teach you later, you'll see that some points are a little harder, and that actually tells me what I want to fix. So I'm going to fix a little tender here. Mm-hmm. Okay, that's her muscular system. So I'm going to fix her muscle system. So I want to fix the part of her brain in the positive pole that controls all her muscles. Now, the 4 points in the negative pole, the levels are C5, T5, T11, L5. I want to stimulate those 4 points to stimulate the cord, send energy up the cord to the positive pole to reset it. When that part of the positive pole is reset, it will monitor her muscles right and send the proper signals to her muscles. So, there's many, many ways to do this. Got a nice audible there on L5, nice one on T11, nice one on T5. Audible or not, doesn't matter, I'm just mentioning it. I'm not going to do a side posture right now, I'll teach you that later, how that fits in. Face me over here, Laura, if you don't mind. I'm going to now adjust her neck, just actually sitting up. That'd be great, awesome. And I'm going to just give her a neck adjustment. Oh, that was awesome. Did you hear that? And that was on C5, beautiful. Go face down, please. Now, looks pretty simple, but people fly to me from Malaysia, Japan, Hawaii, New York, Chicago. I mean, those are places with chiropractors, right? You'd think if you just want a good healing or chiropractic adjustment, you could get it in those places. But people are flying in. Why? Because, for example, I had this guy from Malaysia. It's actually a Canadian guy who works in Malaysia, named Rich, really cool guy. What's up, Rich, if you're watching? So Rich was doing Brazilian Jiu-Jitsu out there. He was a purple belt in Brazilian Jiu-Jitsu, hurt his neck really bad, got an MRI, had herniated discs in his neck. They said you need neck surgery. He didn't want to get it, so he kept going for second opinions until someone would agree with him that they could work with him without getting it. But he went to 4 orthopedic surgeons, I guess, or MDs of some sort in Malaysia. They all said he needed neck surgery. Heard about me, flew from Malaysia, stayed for about a week. I worked on him every day. Obviously, if someone lives near me, I'll say, hey, come, weekly for a few weeks till you're better or whatever it takes. But if someone's flying in from across the world, if they're coming for 6 days, I'll see him 6 days in a row. Anyway, he got all better, went back to Malaysia, never got surgery, neck is fine. He's a black belt now in Jiu-Jitsu. and he's awesome. So, with that said, how long were his adjustments? That long, maybe a minute, 2 minutes, whatever. But if you know where to stimulate the spine, you will do things that regular chiropractic adjustments just can't. They just don't. He actually told a bunch of people, now I have like 15 patients from Malaysia who have come to me with similar so-called dire situations who are all better now. So that's a quick example of the zone technique. I'll feel the head. Is that tender?
No.
Okay, so I felt the point. It's not hard anymore. I know it's actually clear. It's not tender to her either. That part of her brain is governing that system properly. And by the way, I can tell if a situation by the back of the head is chronic or acute. Meaning, for example, you can sit up, Laura, just so you can come hang out with everybody here. So, for example, like let's say someone has a chronic digestive system problem, that is. Well, maybe they say, hey, they've had bad digestion since they were a kid, and they still have bad digestion. That's a chronic digestive problem. Or let's say someone else, they've had great digestion their whole life, but yesterday they got food poisoning. Well, that's an acute digestive problem. Or let's say it's both. They've had bad digestion their whole life and they got food poisoning yesterday. Well, that's a chronic and acute, but I can tell, and I'll teach you how, by feeling the points in the head, which is chronic, which is acute. And it's pretty impressive to a patient when they come in and you're like, yeah, your digestion's off. Hasn't been off for long, but it's off recently. Yeah, sure enough, they got food poisoning a couple days ago. Or a patient comes in, well, your digestion's been off probably your whole life. Sure enough, it has. It's pretty cool to be able to identify that and fix it. With that said, I've never taken health insurance ever. I know chiropractors don't love dealing with health insurance companies. All my patients pay me 100% at the time of the visit, and that's what happens. You might be like, oh, that's kind of basic, like you're just doing these certain points. It's not basic. Look at an acupuncturist. If you don't really understand what acupuncture is, they're just putting like, I don't know much about acupuncture, but they put a needle here, here, and here, because they know those exact points in that order, in that way, can fix your whatever, open up whatever meridian. But if you just look at it from the outside, it looks like you're just sticking needles in you. But there's an exact science to it, and there's an exact science to the zone technique. With that said, it's all about results. You learn this technique and the other principles that I'll teach you, and your results will be incredible. I'll see you soon.